Good afternoon and welcome to StartUpNV's Pitch Day. I'm Andrew Baca. I'm joined by my colleague Brittany and our investment team. Jeff and Maggie, who normally host this event, are out of the office, and we do hope that they are enjoying themselves. I think we may have skipped a cycle, but we're really happy to be here with two pitches, Ephraim from Hutano and Jessica from Bucket. And before we get into the pitches, I'd like to give a few updates from the StartUpNV side. We had an exciting April. A couple of weeks ago, we hosted our annual Angel NV final event. We raised almost $300,000 from an investor group. We had 6 exceptional finalists who pitched in person at City Hall. There were 2 companies that garnered some investments. The winner was CID, an IoT tracking platform for logistics and industrial applications. They took home a $200,000 investment from Angel NV. And Semi-Exact, the runner-up, a tech-driven DIY furniture manufacturer and retailer, took the rest of it. We are excited to do this event again next year. It starts in the late part of January of 2023, and really look forward to doing it again. And thank you to the city for the wonderful event. At the conclusion of that event, we were fortunate to be joined by Michael Brown from GoEd, who was kind enough to help us announce that we are raising a seed fund. You'll hear a little bit months later in the summer about that. So to the pitches. Quickly about the format. One, we are being recorded right now, and there will be 2 separate recordings. One recording will be public and published on our YouTube channel. Additionally, there will be a recording that includes the Q&A and the pitch, and that is not public, but it will be used internally for us to evaluate the pitches. Founders, if you do not want the pitches, please let us know. We're happy to work with you on that. Throughout the presentations, please put the questions into the chat. Brittany will ask them directly to the founder. So we have 2 pitches. I'll introduce the speaker. The speaker will have 10 minutes from the time that they introduce themselves and their company. And then we'll follow that up with 20 minutes of questions and then move on to the next one. Any questions from the team before we move forward?
All right, we're good in the room, Baca.
All right, let's do it. Moving into the first pitch, Ephraim from Hutano. We just saw that beautiful. Let's see it again.
And next, and just plug that in the sun. Okay. All right, excellent. I think we can see you guys. And again, just your speaking, projecting voice. Sure.
And we'll get started as soon as you introduce yourself and the company.
Sure.
Oh, yeah, it's working. So you currently understanding that screen, but
Try to put in right, yeah.
basically just need to know that it's on the presentation.
Try it.
There you go.
Okay. Awesome. So, my name is Ephraim Makube. I am the CEO and founder of Hutano, a health tech platform that makes it super easy for patients to find healthcare providers, book appointments, and pay for services online. So whether a patient is looking for a physical therapist, a physician, a chiropractor, a dentist, or any state licensed provider, Hutano is a one-stop place where they can find and engage with those providers. In a nutshell, we connect patients to providers. However, in the next 8 minutes or so, I will show you how we do more than just connect providers to patients. Agreed, healthcare has several problems. No one company or individual can solve them all. However, Hutano is solving problems that affect cost, access, and efficiency. One must have an efficient way to search and find healthcare providers to have access. But what good is finding a healthcare provider if you cannot book the appointment online? And what good is booking an appointment online if the patient does not know the cost of care or the insurance the provider carries? Healthcare providers cannot determine how to price their services so that patients with high deductibles and no insurance know the cost of care beforehand. Lastly, inaccessibility to my patients' records and documents makes treating my patients similar to flying blindfolded. Although medical records are available to patients on request, there's no independent service like a Google Drive or a OneDrive to store, categorize, and share medical records. So we created a platform with a comprehensive but straightforward search. Say you know the name of the provider's specialty, service, or name. Hutano shows you the providers who match the criteria. Our results are specific and relevant. 2, we have modernized booking. We took what the marketplace has adopted from transportation and food delivery and made booking healthcare as simple as ordering Domino's pizza or hailing an Uber. 3rd, our providers display out-of-pocket prices for medical services. Because patients with high deductibles and no insurance make up the majority of patients, we can accurately say that most healthcare in the US is now cash-based. Lastly, on Hutano, patients can request documents and upload them as PDFs or pictures they've taken with their phones, keeping healthcare records out of shoeboxes. So how does the platform work for patients? During the onboarding, Hutano captures all the data that rarely changes to save the patient from repeatedly entering the same information from provider to provider. You remember your last doctor's visit. If your experience was typical, you went in 15 minutes early to fill out paperwork. Hutano eliminates a step because patients can do this on Hutano before the appointment day. Patients can even upload insurance information, including images of the cards and all the information that's required before the appointment. Hutano asks for patients' location so that the search results are distant relevant and local. Patients can even filter the results by the provider who takes specific insurance. Otherwise, if one has a high deductible or no insurance and knows that they're going to be paying out of pocket anyway, they can shop for the most affordable provider. Now, for the provider, the relationship with Hutano starts with onboarding as well, where Hutano gathers all the information to verify that the provider is a licensed healthcare provider in the state. Next, the provider sets up an availability schedule to communicate when the provider is available to provide which services at which location. At some point, the provider will receive an appointment request. What is unique about Hutano patient requests is the depth of information at the provider's request, at the provider's disposal. Why is the patient seeking care? Medical and social histories are some of the data available to the provider before the patient even steps foot in the clinic. The requests are not leads, but actual patients who have decided to do business with this provider. In most cases, the patients have put their money in the transaction. Hutano's EMR then neatly ties all this together at the end of the treatment so that the patient can review what's going on. Now let's talk about the actual product. Hutano is a platform that works using a web browser. Additionally, Hutano is also available on iOS and Android. We are optimized for search. Hutano approaches search uniquely, delivering relevant and specific search results. Because searches can be refined by distance from the patient, Hutano promotes the local provider. So out of the 500 competing clinicians in one city, 2 might be close enough for the patient to travel. It is the discovery of the local providers that we believe makes Hutano more valuable than the other search engines. That said, Hutano is a great online booking platform, and we add sharing and uploading documents. Hutano makes managing and updating medication lists a breeze. Patients can manage drugs, and providers can add or edit prescribed meds on Hutano. If a provider discontinues or reviews the dose of a medication, Hutano stores the history of all the changes in perpetuity. Imagine having one place for clinicians to review patient meds and drill down to the details of when the meds were prescribed, discontinued, reviewed, and why. The marketplace needs this service. Without doubt, repetition is a bottleneck in healthcare. Let me explain. Patients typically fill out paperwork in medical offices. After completing the paperwork, the clinicians sit with the patients and ask them to recite what they just wrote down. The provider then types the same information in an EMR. Can we all start to see how medical errors can arise from this process? On Hutano, whatever the patient enters in the intake flows directly into the documentation. Consider this. Typical patients have medical grade equipment at their disposal to take their vitals, and most do, regularly too. Heart rate, blood pressure, oxygen saturation, even blood sugar can be measured by the patient in their home using equipment purchased on Amazon. Outsourcing taking vitals and writing the history of present illness to the patient saves time that the provider and the patient have to spend on the day of the appointment. Hutano is a very intuitive user interface for intake. At the end of this intake, a neatly packaged summary called the History of Present Illness, or HPI, is generated for the patient to review. Interestingly but relevant to Hutano, studies have shown that patients who have a follow-up appointment before discharge have a higher rate of honoring follow-up appointments and better healthcare outcomes. It makes sense because having the patient navigate the world of referrals alone never ends well. Several phone calls later and being put on hold for minutes can put a bad taste in the patient's mouth. Hutano bundles referrals in the platform, making it easy for providers to track their referral sources and improving healthcare outcomes. Hutano also improves the logistics of getting patients in and out of healthcare practices. For example, I remember the first time I ordered Domino's using the app. I was fascinated by how the Domino's app showed me step by step how my pizza was being made, all the way to the time it came to my doorstep. Hutano does the same for healthcare. Using push notifications and reminders, Hutano patients can even notify the provider that they're on their way to the clinic. So how does Hutano stack up against the competition? First, there are no real comps because no companies are doing exactly what we do, but companies are doing some of the things we do. In any case, all these companies have comparable provider searching capabilities. Also, online booking is the essential staple of all these companies. However, the herd starts to thin out regarding price transparency and document management. Hutano is one of a few making price transparency a primary feature and the only one with document management. Now let's go to provider tools, where almost everyone post-pandemic offers virtual care. However, if we learned anything during the pandemic is that not every patient should go to the hospital, especially during a pandemic. As a result, there's a resurgence of good old home health visits by clinicians. Hutano is the only platform that makes it easy for a provider to offer care virtually, on site, and in the clinic on one platform. To augment that, Hutano is one of the few providers that are building its own EMRs.
Thank you, Ephraim. I think you're at time now.
That's all right. Thank you.
Can you skip to your ask?
Sure, absolutely.